What do you need to know about non-alcoholic fatty liver disease and how to treat it? I'm Dr. Brett Scher, the medical director at DietDoctor.com. This is an important topic that I want to review some of the basics with you to make sure everybody understands what this condition is and what a potential treatment is. Now, when I was in med school and residency, this condition of NAFLD, or non-alcoholic fatty liver disease, basically didn't even exist. If you had fatty liver, it was because you were an alcoholic. But then all of a sudden, people started to get this condition with fatty liver and liver disease, and they weren't drinkers. And it was even starting to happen in teenagers and in kids. Now, the non-alcoholic causes of fatty liver are much more common than the alcoholic causes. So it should be no surprise that the main underlying reason for it is consuming too much energy. Energy excess and weight gain of any kind can do it. So the standard American diet, standard Western diet of the high carb, high fat, high processed food, high refined sugars, that is likely the number one cause. If you break down the specific nutrients or parts of the diet, it certainly seems that the refined carbs, the sugars, and the fructose are an even greater risk for developing non-alcoholic fatty liver disease. And basically, as the name suggests, it's an infiltration of fat in the liver. But here's the biggest problem. It can progress. It can progress to what's called NASH, N-A-S-H, or even to cirrhosis. And cirrhosis is end-stage, irreversible liver disease, and that's a big problem. It's thought that this is going to be the most common cause of needing liver transplantations, more so than hepatitis or liver cancers or alcoholic liver disease. So, I mean, that just shows how prevalent it is becoming in our society because it's a lifestyle disease and our society has gone the wrong way with our lifestyle. Now, should be no surprise, it's also associated with insulin resistance, metabolic syndrome, abdominal obesity, all the things that go along with energy excess and refined carbohydrates and sugar excess. So, how do you treat it? Well, the treatment is removing the offending agent and hopefully doing it soon in the course, right? So what's the offending agent? Well, not having energy excess, not having too much sugar and refined carbohydrates, and not having too much fructose, right? Removing those agents. So it should be no surprise that studies have shown that low-carb and keto diets are very effective at treating NAFLD, or non-alcoholic fatty liver disease. In fact, there was a 12-week trial using a Mediterranean-style keto diet. And in that 12 weeks, they showed complete normalization of fatty liver. Now, that's pretty quick. Now, your doctor can diagnose fatty liver either by liver function tests, a blood test, or by ultrasound or MRI, different imaging studies. And in this trial, of that 12-week trial, these findings normalized with a ketogenic diet. So it shows that this is something we all can address, and it is a big problem for people who have it, but is absolutely we can address it. Now, keto may not be the only way to do it. It's possible that any reduction in overall energy can do it, but certainly you want to focus on the carbs, the sugar, the fructose as well to get the biggest bang for your buck to reverse your liver disease. Now, this liver disease is a serious medical condition, and if you are going to try to treat it in any way, especially or even with nutritional intervention like we're talking about here, you have to do it under the guidance with your physician. Okay, do not try and do this on your own because your physician needs to monitor you with blood tests and imaging studies potentially, and you are going to need their guidance. You should not do this on your own because this is a serious medical condition. And if it's not working, if by chance it's going the wrong way, you absolutely need to know that. Now, when a lot of people hear me say you need to work with your physician, I get pushback because they say, well, my doc doesn't know anything about the keto or the low-carb diet. Well, that's starting to change. That is absolutely starting to change. Our Find a Doctor webpage now with the map, the interactive map, has over 500 listed clinicians. So please, if you're looking for a doctor who's more familiar with low carb or keto, please go to that website and we'll put a link down below. Maybe you can find somebody who does telemedicine or somebody who's close to you that you can see who can help guide you through this. Or if not, you can even try and help educate your physician. We have a continuing medical education course for physicians about the benefits of low carb and keto diets called Therapeutic Carbohydrate Restriction. If you can introduce them to that continuing education course, maybe they can then become educated about low carb and keto and work with you to understand if this is the right treatment for your liver disease or your diabetes or your metabolic syndrome or whatever the case may be. So the tide is changing. At Diet Doctor, we're happy to be a catalyst to help spread the information, but we need your help as well. We need your help to spread the information to your physicians, your clinical providers. So hopefully this was helpful as a quick overview of NAFLD, what it is, what the causes are, what you can do to potentially treat it, and how you can find a physician to help work with you, because this is a serious medical condition. All right. Thanks a lot, everybody. Have a great day. Don't forget to hit subscribe down below so you'll get all our updates here at Diet Doctor YouTube channel. Take care.